Once you have a C-section, does that mean you always have to have a C-section when giving birth? Well, Dr. Sarah Miller, an OBGYN physician with Women's Care Florida, is here to answer that question and many more. I like that phrase, once a C-section, always a C-section. I have heard this.
Yes, and people do say that all the time, and they come in saying, wait, I had a C-section, do I have to have another? And the answer is no. In many women, it is safe to try and have a vaginal delivery after having a C-section in the past.
Why has it become such a thing where that's such a stigma that everybody holds on to?
You know, it's probably that in the past that was the thought, but really a lot of studies and evidence has shown that it is very safe for women to try to have a vaginal delivery and can offer many benefits.
Okay, let's talk some about those benefits and how it may be a little different to prepare for, or what's the whole process like if a woman does find out she's expecting number 2 or number more down the way.
Exactly. So, I mean, a lot of women want a vaginal delivery after a C-section, mostly for the experience too. A lot of women will tell me, you know, I want to try to push out a baby. I want to see what it's like to deliver vaginally. But not only just the experience, it's easier healing. It's often a faster process, especially if people are wanting multiple children. Having multiple C-sections can put you at higher risk, so having a vaginal delivery with a second delivery might be a very good option.
One here, it actually calls it a trial in a way, trial of labor. So that's kind of a scary thought, I'm not going to lie.
It is. So there's there's VBAC, which is vaginal birth after a C-section. That's when you successfully have a vaginal birth. And then there's TOLAC, or trial of labor, and that's the attempt. So we call it an attempt until you succeed.
I was going to say, I'd be like halfway through, be like, no, I don't know about that. Because you say trial, it makes you seem like, you know, you tried, but it sounds like you're ready. I mean, joking aside, it sounds like if you're in the process of you are ready and know that C-section is in the back of the mind, right?
Exactly. And that's the woman that's a good candidate for trying labor after a C-section. The best candidates are someone who's had a C-section for something like, oh, the baby was breech. Someone who pushed for 4 hours and ended up needing a C-section might not be the best candidate to try for a vaginal delivery because that could happen again. But women who had a C-section maybe because they were only a few centimeters dilated early in labor and baby didn't tolerate it and it had to be more of an emergent situation, they can definitely try for a vaginal delivery as long as the C-section that they had was a normal kind of what's called a low transverse normal C-section, which most C-sections are.
I actually had a C-section. So I'm like sitting here going over in my head, like, what was it again? Why did I have to have one? It sounds like, though, no matter the reason, the key is communication with your doctor, right?
It really is. It really is. I mean, the best thing possible for someone who's had a prior C-section who wants to have a vaginal delivery is for them to go into labor on their own. So it's a conversation that you will have with your doctor and or midwife about, you know, when would be the appropriate time if you don't go into labor by your due date. Are you just going to have a C-section, or what are you going to do from there?
I actually think I've heard friends of mine say before that was one of the big reasons that they didn't want to have a C-section in the first place was because they didn't ever not want to have that as an option anymore.
Exactly. A lot of women don't realize that. So actually, I do tell women when they need a C-section in labor, I often say to them right then and there, just so you know, in the future, you might not be thinking about this, but you might be a candidate to try a vaginal delivery again.
So it's not
it is not
a done deal, off the table.
Absolutely.
Anything else you like to share with people when it comes to C-section? Because again, I feel like, you know, that's what I had, and it just seems like it's one of those things that people hear those words sometimes, and moms do just cringe.
I know, and there are many reasons that a woman would need a C-section, and it really is important to talk to your doctor. No one is going to push you into a C-section without telling you, hey, this is why we think it's appropriate at this time. And nowadays, C-section, you know, they actually make clear drapes so you can watch. Often the baby can be brought over to your chest shortly after. So it is a lot more of a, you know, involved experience than it used to be or what people think it is.
Again, you're just changing what people used to think or what they think about C-sections. So it's so nice to chat with you. Come back and see us, okay?
I will. Thank you.
If you find yourself in the situation where you've got questions and about C-section or anything else in the department, Women's Care Florida, go ahead and get a hold of them for more information today.